A dramatic spike in the maternal death rate in the United States tops our health lead today. An alarming new report from the Centers for Disease Control and Prevention shows the number of women who died due to pregnancy or childbirth complications rose significantly in 2021. And the death rate among black women is twice as high as that of white women. Here to discuss is Dr. Megan Ranney. She's the Deputy Dean of Public Health at Brown University. Thanks so much for being here. So the maternal death rate in the U.S. has been a problem for decades. Why is it still an issue today?
Well, the decades of issues reflect so many of the things that you and I have discussed. The inequitable access to health care. We see higher rates of maternal mortality in states that have not expanded Medicaid access. It's about lack of pre- and postpartum care. So many women fail to show up for visits to an obstetrician in that first or second trimester, don't get care until it's too late to address many of those preventable causes of maternal mortality. And then, of course, there is structural racism. We know that chronic stress plays a role not just in setting up black women for all the things that raise rates of maternal mortality, like high blood pressure or asthma, but also are related to their care in the healthcare system. There's story after story about women who are well-educated, high income. There was even a woman who worked at the CDC on maternal mortality, black woman, was unable to advocate and get herself the proper care and died in the postpartum period. So it's this combination of factors that continue to put the U.S. far behind our peer countries among industrialized nations.
Yeah, I think I heard an interview with her mom on NPR this morning, a shocking story. But I can't help but notice that it went up again in 2021. Mm-hmm. What role did COVID and the pandemic play in this, if any?
COVID was a huge driver of that rise in 2021. And in fact, we have preliminary data showing that rates dropped in 2022 as COVID, as many of us got vaccinated and as the new variants became less serious. So let me be clear that if you are unvaccinated, pregnant, and catch COVID, your rate of intensive care unit admission, being put on a ventilator, or God forbid, dying, is somewhere between 4 and 10 times that of someone who is pregnant and does not catch COVID. So vaccination, first of all, is huge. But secondly, being pregnant and catching COVID puts you at a large risk. And most of that increase in maternal mortality in 2021 was due to COVID-related deaths.
So what does society, what does Joe Biden, what do the governors need to do to start reversing this trend?
So the first and biggest thing is to expand Medicaid. We have seen study after study showing that states with Medicaid expansion have lower rates of pre-delivery as well as post-delivery mortality. So that's make sure that everyone has access to insurance and that it's easy to get. The second is to make sure that there is access to obstetricians even in rural areas. There are lots of closures of hospitals in rural areas. Many of the women who are at highest risk of maternal mortality live more than 25 miles from an obstetrician, so making sure that there is that access in rural areas. And then the third thing is addressing all those problems that lead people to have a higher risk during pregnancy or immediately after delivery. So addressing rates of high blood pressure, addressing food access, addressing mental health, and then of course addressing the structural racism in the healthcare system. Jake, there have been studies showing that if women are treated by black doctors, their rate of mortality is lower in the peripartum period. So training up more black physicians will also help with these disparities in mortality rates.
So I'm sure there are some pregnant women watching right now, mm-hmm. and they're terrified from this report. What reassurance can you provide for them? What recommendations? Look, I know they literally write books about what to do when you're pregnant, but quickly, the quick advice you can give, what would you tell them to do to have the healthiest pregnancy as they can?
So first and biggest thing, make sure you see that obstetrician in the early parts of your second trimester, if not before. Second, get your COVID vaccine, and if you're eligible, get boosted. Try to avoid catching COVID during pregnancy. And then the third thing is to make sure that you get access to the insurance that you are eligible for as a pregnant woman.
You address mental health for expecting and new mothers. What is access like for those experiencing post-natal depression?
So it's just like with all aspects of mental health in this country, there is an absolute dearth of therapists and psychiatrists who can treat women who are suffering from postpartum depression. It is absolutely an epidemic in this country, made worse by lack of parental leave, by issues with access to childcare, all the things that combine to make being a parent in this country difficult. Add on to it the fact that therapists are in short supply across the country. Women in the postpartum period are in no different position.
Dr. Megan Ranney, thank you and congratulations on your new job. You're going to be going to Yale, be the Dean of the School of Public Health, is that right?
I am, yeah.
You're going to still keep coming on.
That's up to you, but
on
yeah.
the lead, right? Okay, good. I think they have
Thank you.
studios in where is that? Connecticut somewhere?
Somewhere in New
Somewhere
Haven. Yeah.
in New Haven, that's right. All right, Megan, thank you so much.
Thank you.